Hello, I'm Dr. James Bogash, publisher of Modern Health Myths. Today we're going to talk a little bit about the gastrointestinal or the GI tract manifestations of COVID. This particular study looked at just over 1,000 patients that had presented in New York City and had found that overall about 33% of the patients had GI complaints. Now, there's some interesting things to be associated with this. Despite the fact that we've known this for a long time, even evidence coming out of China, it still is not typically associated with the gastrointestinal tract. Most people think of COVID as a respiratory problem, but it has a pretty significant role to play in the gut. So, to get into the specifics, they found that 20% of the patients had diarrhea, 7% had abdominal pain, 16% had nausea, another 9% had vomiting. When you put all those together, about 33% of those patients had, 33% of the 1,000 plus patients had GI complaints, which is a pretty high percentage. I think we've seen numbers out of China as high as 40%. So definitely looking at that same range as far as how many patients experience COVID in the GI tract. About 63% of the people had elevated liver enzymes. Now, before we panic about that, elevated liver enzymes don't necessarily mean that we're going to have long-term liver damage. Elevated liver enzymes are seen in a lot of other scenarios, prediabetes, which is really common. And so long as everything goes okay, the liver has an amazing ability to bounce back from the abuses that we place upon it. So before you start panicking, the fact that 63% had elevated liver enzymes, this is really just a finding on labs and not necessarily anything we need to panic about. On the flip side, something we should be interested in is that the death rate of those people who had GI complaints was about half that of the people who had respiratory complaints. So it seems like if you're going to get COVID, you might be better off getting this in the GI tract than you might be in the respiratory tract. The sometimes I can go with the one of the things I did find interesting is that these were hospitalized patients. And diarrhea generally doesn't land people in the hospital to find out that they had COVID and then find out that that was part of their presentation. It may just be that the diarrhea was severe enough and these people did not stay hydrated, so dehydration is a frequent reason why people stay or end up in the hospital with diarrhea. So something to consider as far as staying hydrated with something not like Pedialyte, generally emergency or any type of electrolyte mix that's higher quality with nothing, no artificial colors or anything. It's a much better option. A couple other things to say about this. It also makes it wonder, there's been some discussion, not much, but some discussion about transmitting COVID. Most people might be aware of the reason why you should leave your toothbrush as far away from the toilet as possible. It's because when we flush, the aerosol, the plume that comes out of the toilet is quite extensive. So we're worried about wearing masks, but the reality is public restrooms, anywhere where we flush the any fecal matter down can kick all of that viral material back up into the air where it can be transmitted. So it's a very real potential for where the COVID may be getting transferred. Another thing, this just brings to light again the importance of having a healthy microbiome, not just in our respiratory tract, but in our GI tract. Our body has the ability to fight off. If we have a healthy microbiome, it becomes another layer of warriors in keeping things like viruses and other bacteria from gaining a foothold. Also, I mentioned that we might be better off having GI complaints versus respiratory complaints. The immune system, as far as immunity and long-term immunity, doesn't recognize where it comes from. So if you got infected in the GI tract versus the respiratory tract, the immune system, you're still going to develop the same long-term immunity regardless of how you were infected. So as always, I'll post a link to this particular study in the comments section, and feel free to like this video, share it with somebody who you think may need the information, and subscribe to the channel.